I'm quite aware that I probably, in fact, I'm going to say the word probably. I know what I've done. I haven't really posted about this, and therefore I haven't got many questions tonight. Full disclosure, I put a desperate bid out. I've been a bit delaying the start of this because I thought my desperate bid would work. I put my desperate bid out TikTok page. Yeah, you heard me. TikTok. There you go. I'm now on TikTok. It's called the Staiano Clinic, at the Staiano Clinic, which I believe is the same as the Instagram. I put a desperate bid out on TikTok, and neither of my followers have responded to it, so I'm quite surprised at that. Nevertheless, I have got a question, and I have also got a question that I've just seen. So I'm going to answer that. So I should have said to that person who I answered the question. In fact, I'm going to tell her. I'm going to talk about it. I'll talk about this. She's just sent me a message on Facebook. I'll talk about this on the Q&A tonight. So if you've got any questions, now's the time, guys. Now is the time. This is a golden opportunity. You've got a real life, fully fledged plastic surgeon in front of you who is wide open. Nevertheless, I have got some things to talk about, which I shall talk about in the absence of any of your questions. But as I say, if you do have any questions, please feel free to ask them, because I've got, to be fair, there are a couple of belters. This is a question that I got. It's interesting. What's the difference between a tummy tuck and a Brazilian tummy tuck? So this Brazilian tummy tuck thing came out a while ago, and people were talking about it, and it seemed to be sort of all the rage. And so I did a blog post basically saying, what is a Brazilian tummy tuck, and basically saying that it isn't really any different to a normal tummy tuck. And I don't particularly say the tummy tuck that I do is a Brazilian tummy tuck. It's just a tummy tuck, and I just think it's a bit of, I don't think there's anything significantly different about it. I will talk about, there are some differences, which I'll talk about, but I don't think they're significant. And so my blog post was basically saying, that. It's amazing the amount of inquiries I got afterwards. People saying, I want a Brazilian tummy tuck. Can you do a Brazilian tummy tuck? I'm like, hold on a minute. Have you read the blog post? The blog post wasn't saying I do Brazilian tummy tuck. I just do a normal tummy tuck. I don't. And I think I understand it. I think when something comes out like a Brazilian tummy tuck or a vampire facelift or something with a name, like vaser liposuction, or just something that sounds a bit different, people often think that's got to be better because there's a Brazilian one now. Let's do a Brazilian tummy tuck because that's got to be better than a normal tummy tuck. When you actually look into any of those things, there's often not a huge difference between them and the normal thing. I think there are different types of tummy tuck, no question. There's a mini tummy tuck, a full tuck, a Fleur de Lis, 360. There are different types of tummy tuck. But when it comes to the nuances of how you do a full tummy tuck, we all have nuances of how we do them. There's nothing significant. And I think someone somewhere, I don't know who, someone has coined the phrase Brazilian tummy tuck. But when you actually look at what they're saying they do with a Brazilian tummy tuck, I mean, I don't know if it's just me. A lot of the things I do it already. So what are the differences? So number one difference that they say a Brazilian tummy tuck is different to a full, to a sort of standard tummy tuck, is they say there's limited undermining. So when you do a tummy tuck, you take all of the skin from the belly button down. So the skin from the belly button down is removed, and the skin from the belly button up to the rib cage is then stretched and pulled down. Now, in order to stretch and pull down the skin from the rib cage up, if you just cut that bit of skin out and then try to pull it down, it won't move. So you have to undermine. You have to undermine the skin from the belly button up to the rib cage. Now, what they say is that a Brazilian tummy tuck just has a small tunnel going up to the rib cage, only wide enough to allow you to repair the muscles. Whereas the implication is that a full tummy tuck will undermine all the way along the rib cage. Do you follow? Do you get me? So they're just doing a tunnel here with a mini, whereas a full would be undermining all of this. So this gets removed. Not a mini, sorry. A Brazilian just undermines here, and they're saying a full does everything. Now, I haven't undermined everything for years. You don't you don't undermine everything with a full tummy tuck. You only undermine a tunnel with a full tummy tuck. You don't. The tunnel. I've been undermining a tunnel. It's only a tunnel for a tall tummy. You don't do wide undermining. Wide undermining increases your risk of seroma. It's a bigger dead space, more risk of vascularity problems to the skin flap and wound healing. So that is the same with the tummy tuck that I do, and I think most people just undermine a tunnel, and the tunnel is just wide enough in order to get the give in the skin so it'll pull down, and also, as I say, wide enough so that you can repair the muscles, so you repair the recti muscles as part of either of them. So that's exhibit A, that they say a Brazilian is different. Exhibit B, they say a Brazilian is different because they don't use drains. And I do use drains, and they say, well, I believe what they're saying. I mean, at the end of the day, really, I guess you should talk to someone who does Brazilian tummy tucks, really, or at least promotes themselves as a Brazilian tummy tuck guy, to who knows about both of them. But anyway, to get a balanced opinion, because I don't propose that I'm particularly a Brazilian tummy tuck guy. I'm just a tummy tuck guy. So they say that because it's limited undermining, then you can avoid using drains. Now, you can avoid using drains in a normal tummy tuck, and many people don't use drains for tummy tucks. And yes, that's true. The less undermining, the less dead space, so the less the need for drains. But as I say, I do limited undermining, and I still use drains because I believe that it's the skin flaps are going to stick down better, and the seroma rate is going to be low. And I know that there are studies that have shown that the seroma rate is low even when you don't use drains, but it's lower when you do use drains. So I don't really have any problems with seroma. It's a very rare problem for me, so I don't really want to change things because it can be a bit of a nuisance when you get seromas. So that's just my personal view on it. And so the reason I use drains is not because of the undermining, it's because I believe that they're a better way to get those skin flaps to stick down. So, and as I say, you could easily not use drains doing a standard tummy tuck with a narrow tunnel. And lastly, and probably the only difference between a Brazilian tummy tuck and a normal tummy tuck is the liposuction. So it's quite normal to do liposuction to the hips and flanks. Let me demonstrate these bits here. Yeah, obviously there's nothing there on me. You know, it's all bone there. But you know, not obviously. So those are the bits that you can do with a normal tummy tuck. You do liposuction. It's not unusual to combine a tummy tuck with liposuction to those areas there. What they talk about with the Brazilian tummy tuck is doing liposuction to this bit here, the upper abdomen, liposuction to the upper abdomen. So that is different, because I don't do liposuction to the upper abdomen, and there's many people who don't do liposuction to the upper abdomen at the time of a tummy tuck, because the worry is that it's going to affect the blood supply of that skin flap, and it's going to reduce the healing and increase your risk of wound healing problems. So that is our rationale for not doing it. But again, I'm aware that some people do believe that it is okay to do it. Many patients ask for it and think they're going to need liposuction to the upper abdomen, but actually, when you do a full tummy tuck, because you're stretching that skin that normally goes from the belly button to your rib cage all the way down, so it has to stretch down and cover your whole abdomen. It's not that common to need liposuction to the upper abdomen, because it sort of gets thinned out because it gets pulled down. But sometimes it is, and there may be patients out there who would benefit from it. But I would worry that it would affect the vascularity of the skin flap and the healing. So I don't do it. And if you need it, I would do it as a second stage. So that is a difference between a Brazilian tummy tuck and a standard tummy tuck. A Brazilian tummy tuck, they tend to do more liposuction to the upper flap, to the upper abdomen. As I say, the reason I don't do it is because I worry about vascularity and healing. But obviously the people who do it feel that they can do it in a way that they have, you know, they can be safe and not get problems with the vascularity and the healing. And the problem with plastic surgery is often there's different viewpoints. It's not necessarily one's right or wrong. And if someone's getting good results by doing it, then great. And if someone's getting good results not doing it, then great. You've got to do what you feel comfortable with. But I don't think it's going to have a significant result or a significant difference in the result. And certainly if you look at the results of someone who is saying they're doing Brazilian tummy tucks versus someone who's saying that they're doing just a normal tummy tuck, they don't look noticeably different. And I think if you did a study where you got patients, surgeons, whatever, and you got 10 people and said, look, 5 of them had a Brazilian one, 5 of them had a normal one, which is which, you wouldn't tell it. I've always said, same with the breast implants, people choosing breast implants, getting all wound up about different implants, different makes, manufacturers. It's the surgeon you got to choose. You get good surgeons and bad surgeons, and I don't think the technique, certainly in terms of a Brazilian versus a standard tummy tuck, is going to give you a better or worse result. It's the surgeon that's going to give you a better result. Good surgeon with either technique would be better than a bad surgeon with the other technique. Anyway, you know what I mean. Anyway, the surgeon's more important, basically. So yeah, so the main difference, as far as I can see, is liposuction to the upper skin flap, which is performed in a Brazilian tummy tuck rather than where it isn't performed in a normal tummy tuck. And if you think that sounds good, then maybe you should go for a Brazilian one. But but you know, that's the difference. But there are reasons why we don't do it. You know, there's always a reason. If someone says, I've got the best new technique and no one else does it, and it's really good, and I'm the only person who does it, I mean, you might think, oh, brilliant, I'll have it done with him because he's the only. You got to think, why don't the other guys do it? Now, unless it's because I've got some technique that I can hold a stitch in a special way and I've got a hand which can move like that and no one else's hand can move like that, or some reason that I'm the only person that can do that technique and no one else can, you've got to worry that there's a downside to it. Because if they're telling you it's all upside and no downside, you've got to ask the question, why don't the other guys do it? If there's absolutely no downside to it, there's got to be a downside. Otherwise, everyone would do it. And you just got to be honest and with patients and say, look, there's an upside, there's a downside. The upside is you can thin this flap out a bit. The downside is it might affect the vascularity and affect the healing of the skin. Right? It's like the politicians when they talk about all this, whenever they say about their manifestos and things, they always just talk about upsides, don't they? Oh, I'm going to help the homeless, and I'm going to help businesses, and I'm going to help the NHS, and I'm going to help exporting goods, and I'm going to help homegrown goods. You know, you can't do everything. You've got to say, look, there's good things about that, but we're going to have to take it from there. So we're going to have to take some money from there because we think it's important to put it to there. But they never want to say they're going to take some money from there. So there's always upsides and downsides for all these things. So just be aware, ask the questions, look for some results, choose your surgeon. If you find you've got a good surgeon, I wouldn't worry too much about the Brazilian thing, in my view. Personal disclaimer. So that's where I am on that one. 50% the way through. That's the Brazilian tummy tuck question. The chat is kicking off, mainly Olivia. That's all right. Khan says hello. Hello, Khan. Olivia, you're cracking off with the comments, loving it. Hey, JJ, good evening. I didn't get the live notification. I hope you're well. Today would have been my surgery day. Oh, God, I feel very sad. Oh, dear. I didn't get the live. Is that, oh, God, am I supposed to do a live notification? What's a live notification? Oh, blimey. Question, how many days after a tummy tuck can you have a full shower, including hair wash? I didn't get the live notification. Anyway, Olivia, so surgery day in hospital, probably 2 nights, then go home, come back a week after. So it's a bit tricky because the dressings are sort of down in your sort of lower abdomen, groin area. They're not very waterproof, to be honest with you. So it is a bit tricky when you've got the dressings on. You could sort of have a little bit of a go with your back to the shower. But if you're talking about a full shower with hair wash, booyaka, the whole shebang. It's a bit of dinner there. Got a bit of dressings come off after a week, Olivia, give or take a day or two, depending on the clinics. And then, to be honest with you, a week, then you can have a shower, I reckon. Yeah. I mean, I wouldn't go crazy on putting anything on the wounds, but you can certainly wash your hair and use soap and things like that and let the water run. But I would just sort of leave that area alone. But you can still have a gentle shower. I don't know what you mean by a full shower, but you can have a gentle shower, Olivia. straight up. Well, after a week, I would say. Week to 10 days, depending on when the dresses come out. Question. Oh, look at this, Olivia. Come on, Olivia. Let's get these questions out there. Are the stitches inside or outside on a tummy tuck, thigh lift, and boobs? Right. So, like your question. I like that question. So, because a lot of people would talk about, are the stitches dissolvable? And the answer to that is, in my hands, full disclosure, this is just me. In my hands, they're dissolvable for all of those operations: tummy tuck, thigh lift, and boobs. We always use dissolvable sutures. Now you're asking the question, but that's not what you're asking, is it? You're saying, are the stitches inside or outside? And again, different with different people. So let's do them one at a time. Tummy tuck. So with a tummy tuck, you have a big long scar in your lower abdomen and a scar around your belly button. So the big long scar along your lower abdomen is inside. You don't see any stitches. So again, all these stitches are dissolvable, but you don't see any stitches. Now the scar around the belly button, I do put stitches on the outside for the scar around the belly button. It's always a difficult shape. It's not quite a circle. It's like a shield shape. We make it into a certain funny shape, and it can be awkward getting into the nooks and crannies. I do a special sort of stitch if you're interested. It's called a Barron stitch. So the problem with you putting stitches on the outside is that you can get stitch marks. You know, like a pirate has a scar with dots, a line with dots on either side of it. Those are stitch marks. So we try and avoid stitch marks. So that's why for that long scar in the lower abdomen, we bury the stitch. There's no stitch to see, so there's no stitch marks. Now, because it's a funny shape, I do put interrupted sutures. You can get a bit more control over an interrupted suture rather than a buried suture. So I'm putting an interrupted suture in. But what I do is I put it through the skin of your belly button, and then I go through the dermis, so not through the skin. So it's buried on the other side, and then I come out through the skin of the belly button. I don't know if I'm making this clear. So actually the stitch marks will be inside the belly button. So there's no stitch marks on the skin on the outside of the belly button, and it's usually inside the cave, so you can't see any stitch marks. But you might see the stitches. So you will see the stitches, to be frank. You'll see the stitches around your belly button, but I deliberately do it so I don't leave any stitch marks on the skin of your abdomen. All the stitch marks are sort of inside your belly button. And some people will do a tummy tuck with dissolvable stitches all the way, and you might do stitches with, it shouldn't have too much of a problem if you did have stitches on the skin of the abdomen. But the problem with using interrupted, or at least stitches on the outside which are dissolvable, is it's unpredictable how long it takes to dissolve. And so if it takes a bit longer than we'd hope to dissolve, there's a bit more likelihood of getting a stitch mark. So we don't very often use dissolvable sutures on the outside, but the belly button is one area. I just coughed live on air. Oh God. The belly button is one area where you might, I use dissolvable sutures on the outside, and tummy tuck, thigh lift, dissolvable all the way, a bit like the tummy tuck one. Boobs, if you're talking about breast augmentation, they are hidden, not dissolvable, hidden and dissolvable all the way for breast augmentation. For breast lift, they are hidden for most of them, but the confluence of all the stitches at the T-junction, where that scar meets that scar, the T-junction of the breast reduction, that's where you're gonna, or breast lift, that's where you're gonna get any wound healing problem. And that's a confluence of a lot of stitches. So the last stitch that I always put in, I put in on the outside. I put the knot on the outside, so there's not too many knots down deep. Now it is a dissolvable suture, so it is clear. It's a clear, transparent suture, so you can't actually see the suture, but you might feel it. Sometimes people feel it down at that T-junction when they've had a breast lift or a breast reduction. And they might say, hold on a minute, you've left a stitch. Look, I've got a stitch here, you left it. I'm like, no, I haven't left it. I've deliberately put the knot on the outside rather than burying it, just because there's a lot of knots in that area. So you might notice a knot on the outside on the T-junction of a breast lift or reduction, and you will see some knots on the outside around the belly button of a tummy tuck. But other than that, all the sutures are on the inside for tummy tuck, thigh lift, and boobs. And that, Olivia, is a gold star, because that is a good question. I like that. That is a gold star. Because to be fair, I have had 3 questions tonight, but the other 2 questions I answered last week. So but that is a good one. Have you started doing the NHS work? No, I haven't, Olivia. Now, the NHS work that I was, actually, no. Oh, God. Olivia, I'm not allowed. I've signed a contract. This is going to sound a bit odd. I've signed a contract that I'm not actually allowed to talk about it, which sounds a bit weird. I have asked them that I can talk about it, but yeah, so I better not say anything more actually, because I've had to sign a contract to say I don't know why. But anyway, I've spoken to my colleagues in the NHS, and certainly the plastic surgeons in the NHS all around the country. I've got friends who are in up north. I've got friends in London, down south. They seem to be coping in terms of the plastic surgery. We're sort of limited as to what we can do. The message we're giving people is try not to sort of injure yourself, basically. So be careful with DIY and what have you. And we seem to be coming up okay in terms of plastic surgery. But I think the main area, aside from the other thing that the contract thing would be, if a lot of plastic surgeons go ill and become self-isolated, they need people to do the hand trauma and things. But that's not the case at the moment. Yeah, sorry, I better not. Don't want to get in trouble. So, how soon should you wait after pregnancy to have a TT? That's a good question. That is a nice question, Mrs. Nice. Really nice question. So, minimum 6 months, in my view. Ideal, a year. The reason being, first of all, you want the tissues to sort of retract and to settle, to be as good as they're going to get, because you might find that everything retract. You know, when you first have the child, you might think, oh, this is terrible, and then as the months go on, things will retract, and you might feel a bit better. So you want the tissues to retract as much as possible. Also, when you have a child, your body prepares for delivering the child and puts you into a hypercoagulable state. It makes you want to clot. It makes you more likely to clot, and so you want to give those hormones to get out of your system, so you're not increased risk of getting clots, DVTs, PEs, things like that. So you don't really want to put yourself through surgery anytime sort of soon after having a child, and you got to, your body needs to relax and sort of recover. So 6 months in order to let the tissues settle would be, I would say, the minimum. And then I would also say ideally a year, because it's a bit tricky if you've got a 6-month-old at home. To deal with a 6-month-old recovering from a tummy tuck is quite a big deal. A tummy tuck's quite a big operation. And, you've got to factor that in. You're going to go home and have a 6-month-old at home that you've got to look after. Around a year, maybe your baby started walking, maybe a little bit easier to manage. Now, I accept they'll be a bit heavier, but I reckon a year might be a bit easier to manage if they're walking and things like that. Now, I understand also that a lot of people will be on maternity leave and want to have it done during the maternity leave, and the maternity leave will finish at a year, so they might want it done at 9 months or whatever. But from a medical or surgical point of view, I think a year is probably better than 6 months, but 6 months is minimum, in my view. The notification comes up in news feed normally. Does it? I don't know, Olivia. Don't know. Have I done something different? I don't know. Gin Tatler. That's a good name. Gin Tatler. Oh, Gin Tatler. Will moving fat from the tummy into the pubes give the same effect as implants? Good question, Gin. That technique is called fat grafting, has been around for a while and is a very good technique and is a very useful technique. And on paper, it sounds great. Move fat from my tummy or my bum or this or my hips, put it in my breast. Avoid implants and everything's fantastic, and I'll definitely have that done. In my hands, it's not quite there yet, and the volumes are not the same as the volumes you can use with an implant. To put it in perspective, the sort of volumes for fat grafting, if I was putting 100 cc's in each breast, 150 would be massive. So 100, 120, or that would be big volume for fat grafting, for injecting fat. When you're using implants, you're using 250, 350 cc easily, maybe even 400, in each breast. So you can 400 cc each breast, that's 800 cc's. You can never do that in fat grafting. So there's nowhere near the volume that you can use in fat grafting than you can in implants. So the point is, it's subtle. The results are subtle, It's quite a long operation. It's quite a big operation to do fat grafting. Therefore, it's quite expensive. It's almost as expensive as having implants, and yet the results are subtle. It's usually not quite a cup size. Again, I'm talking about my experience. You might find some people out there who can get more volume in, but you're limited to the amount of volume you get in because you're not supposed to put the fat into the breast. You've got to put it on the outside of the breast, underneath the breast, around the breast. You're not really advised to put it inside the breast tissue. So you're putting it around the breast. And so you're limited to how much volume you can get in there. And so it is usually quite a subtle result, probably less than a cup size. And in my experience and in my hands, it is better for an asymmetry. One breast a little bit bigger than the other, and you may be just enhancing one breast with fat. It's natural. Then that will be a good use of it. Also in deformities, defects, problems with rippling or implants being visible or something like that, fat grafting is great that you can cover it, but it is usually a subtle result with fat grafting. So in my experience and in my hands, it's not quite there to give the same effect as implants. It can give a similar effect of implants. It's a lot more subtle, and because it's subtle, it often needs to be repeated. And because it's quite expensive and you're repeating it 2, 3, 4 times, all of a sudden it becomes a very expensive option. Although I understand a lot of people don't want implants, want to be natural, which of course it is. And if you put on weight, if you lose weight, the fat will react in the same way that it would have done if it had been on your tummy. So that's a good thing. So there's a lot of good things about it, but you have to be prepared for the fact that it is quite expensive and it is quite subtle. And I wonder if we're going to get better at it and be able to do bigger volumes in it, and it might take over from implants, but in my experience, it's nowhere near there at the moment. It would be great if it was, but it's not. Julia, hi-oh, Julia. Gemma, Breath Bannon. Big up, yeah. Fascinating stitch info. Can I use that as a testimonial, Olivia? Put that on the website. Tune in Tuesday night, 7 p.m. for fascinating stitch info. Whoops. Dawn, long time no see, Dawn. No, you come out of... Yeah, they're all out tonight. Gemma's out. Hey, Jonathan, hope you're well, not too bored at home. Gemma, I'm not bored at all. I want to be bored. I'm not at all bored. I'm not bored. I've got a lot on. I want to be honest with you, Gemma, I want to stop and just... It's all go. Jackie, hi Jackie, good to see you. Nice smiley face. Beth, hi Beth. Olivia, straight in. Question: 180cc implants, how much do they weigh in terms of weight on the scales? E.g., will I be 2/3 pounds heavier in weight? Oh my god, 180 grams, Olivia. I don't know what the 2/3 pounds heavier is, but they weigh 180 grams each. Is that helpful? So 360 grams, 2/3 of a pound, kilogram, 2.2 pounds, 360. Yeah, is it 2/3 of a pound? Yeah, is it? I don't know. Yeah, I think anyway, that's what it is. It's grams. Beth, if a textured implant which were put in 8 years ago with no problem suddenly swell, what does this mean? Oh, Beth, funny you should say that, because that is my next one. Right, I'm going to go to it. Thank you, Beth, for asking me that question, because here we go. That's useful information. 8 years ago with no problem suddenly. Right, there you go, Beth. Swelling of your breast after implants. Okay. What this means, Beth, is that you need to seek help. If you have had implants and they suddenly swell, then you need to seek help. So there's a couple of things. The first thing, and the obvious thing, if someone phoned me up and said, oh my god, my implants just swelled up, the thing that I would worry about is infection, number one. But if the overlying skin looks normal, if it's not painful, it's not tender, then infection is sort of less likely. And so I would be less worried about infection. So infection would be my first thing. I'm like, oh my god, it's infected. And yes, you can get an infection. Obviously the risk of infection is the first few weeks after having surgery, but there is a possibility of getting infection years later. It's not common, but it's out there. And it's usually due to some kind of transient bacteremia, bacteria getting into your bloodstream somehow. Could be something like dental work, having some dental work and some bacteria get into your bloodstream, or if you have an illness, of cold, a flu, something like that. You can get some bacteria. So it's a rare, but it can happen that you can get infection sometime after surgery. So that'd be number one. But if the breasts look normal, as in terms of the skin looking not red, not inflamed, not tender, and it just looks swollen, then that's different. Then I'd be less worried about infection. Then that's a spontaneous swelling. And the main thing, the first thing I would think about is ALCL. So ALCL is a type of cancer associated with breast implants. It's very rare. So I wouldn't fly off the handle and I wouldn't go crazy about it because it's a very rare thing. But it's the first thing. Obviously, you want to, exclude the important things first. So it seems to be related to textured implants, and it usually presents as a lump or a swelling sometime after surgery. 8 years is classic, to be honest. That sort of time frame. And so that's the first thing I'd want to exclude. So my advice would be go and see a surgeon. Call up your surgeon, ring up your surgeon. Yes, we're all locked down all over the place, but we're still here. And we're still, I don't think I'm your surgeon. If I am your surgeon, call me, but I don't think I am. But if I, call your surgeon and say, I'm a bit worried because I've had a swelling, and I'm sure they will, treat it seriously and see you. Because ALCL would be the first thing that you would worry about. And then they'd have to go down the road of what do you do about it. And so the sort of way you go down the road would be, the first thing would be a scan, which would usually be an ultrasound scan, like when you're pregnant, just to delineate the swelling and see whether what the swelling is, whether it's solid or fluid, probably fluid. And then at the time of the ultrasound, they might be able to put a little needle in, drain some fluid off, and then they would have to specifically test for ALCL with that fluid. Now, if it is ALCL, it is treatable, and it's treatable by removing the capsule, the scar tissue that will have formed around the implant, and the tumor. The ALCL is a cancer. It's not breast cancer; it's a lymphoma. The vast majority of cases are cured by removing the capsule with the implant. And but the first thing would be to make a diagnosis. So that's the number one exhibit A thing that I'd be worried about. As I say, if the skin looks normal, then I'd not really worried about infection. If it's just a spontaneous swelling, then ALCL needs to be excluded first. Now, if ALCL is excluded, then you say, well, what is it? I'm like, okay, well, that's good. ALCL is excluded, thank goodness. Well, then it's probably a spontaneous seroma, a spontaneous swelling of your breast. Again, it's a very rare thing, but it's certainly not unheard of. When they do the ultrasound, as well as taking some fluid away for checking for ALCL, they could drain it. They could remove all that fluid. Sports bra on, hopefully it'll settle. If it doesn't and it keeps on coming back, then you can look at things like seeing if there's a reason for the swelling, if there's something there, foreign body or something, and you might need to have your implant removed, maybe your capsule removed. But the first stage is be checked for ALCL, drain the swelling, supportive bra, hope it doesn't come back. Well, assuming it's not ALCL, hope it doesn't come back. And it might have been, again, it might have been some kind of transient infection that or you were just a bit run down and you got a bit of localized swelling in the breast, not necessarily infection, but just swelling, which might, once it's drained, settle as quickly as it's come. And I have seen that. I have seen people, in fact, I've seen people where we haven't drained it and it's just settled on its own. So they can settle. So don't worry too much about it. But I think the main message to you would be that you have to go and get it checked, because the first thing is we need to remember that ALCL is out there, although it's extremely rare. So don't be too sort of, oh my God, he's told me I've got ALCL. It's just like, that's what we need to be thinking about. So yeah, good question, Beth, and that's where I would be on that one. Olivia says, yes, of course you can. What was it? What was that too? I've lost control of the stream. I know I never got around to rebooking my appointment. That got cancelled. Did I cancel an nice one, Dawn? Say live on TV that you got an appointment cancelled. Who cancelled it? It must have been you, Dawn. I can't believe I'd have cancelled it. Rebook it, Dawn. Get yourself, well, actually at the moment, don't worry about it, because, well, you can rebook a virtual one. You can do a phone one. But Yeah, maybe when it's all over, rebook it. Be good to see you, Dawn. Good to see you. Joe, if you had upper eyelid surgery, would they be dissolving stitches too? Surgeon dependent? Normally no, Joe. Normally no. Normally what we would do with an upper eyelid surgery is a non-dissolvable suture, but we avoid stitch marks in that situation by using what's called a subcuticular suture, which means it's buried underneath the skin. It sort of goes zigzags in and out, and then you pull it tight. So it's just one bit of stitch pointing either side, and you go woo, woo, like flossing, you know, just put it through, and then we steri strip it down. So you often, I don't, this is a sort of standard way of closing an upper eyelid. Steri strip it down. There's no knots, and then you come back a week later or whatever, take the steri strip off, and then just pull it through, pull it out. So pull through, so no stitch marks, but it's a non-dissolvable suture. The thing about dissolvable sutures, although they might sound good, you might say, look, hold on a minute, I don't want stitches out, I don't want to be tugged about. The thing about dissolvable sutures is it's unpredictable how long they're going to take to dissolve, and they do cause some inflammation while they're dissolving. So the scar is a bit more red while they're dissolving. So if you want the best scar possible, certainly in the early stages, a non-dissolving suture is better. A non-dissolving suture where you can predictably know when you're taking it out will give you a better scar, because you can say at 5 days, at 7 days, whenever that scar is going to, that stitch is going to come out, and you won't get that inflammation that occurs while the stitch is dissolving. In 6-12 months down the line, the scars will be comparable, but certainly in the early stages, a dissolving suture does cause a bit of inflammation, so it might cause a bit of redness, whereas a non-dissolving one doesn't. So often on the face, we will use non-dissolving sutures on the face because we want the best scar possible. We don't want that redness and that inflammation that can occur while the scar is dissolving. Olivia's going to Google it. What are you going to Google, Olivia? In my lower eyelid surgery, they weren't. They had to be removed, which was fun. Yeah, they often have to be removed on the face, Olivia. Yeah, probably worse on the lower eyelid. So lower eyelid, probably stitches. Boo. It's the removal of them that holds me back. Oh, the stitches. Oh, I see. Oh, boo. I like boo-hoo. Yeah. Yeah, it's the upper eyelid. It's just a pull through. It's not normally that bad. Not that I've had it done. All natural. But yeah, well, no, you're not. You might need to be though. Oh, right. Oh, okay. Always best to see your original, Beth. Always best to see your original. They've got a vested interest to help you out. But yeah. Faye O'Flaherty. So want to get booked in with you. Email today. Awesome, Faye. That's what we want to hear, Faye. That's the sort of, that's it. Dawn, that's what we want, Dawn. Not I cancelled, you know, you cancelled my appointment. I haven't rebooked it. This is the sort of comments we need. Huh? So a bit of positivity. Thank you, Faye. And now Faye's just put that of her own free will. I haven't, you know, we are not related. Thank you, Faye. Well, as you probably realise, Faye, I'm happy to do a virtual one, Faye. Happy to do a virtual one. But the real ones, let's hope that it's not long before the real ones come back into play, at least in our little clinic, because I think we can control our little clinic. We can space out appointments. We can distance ourselves. You know, we don't have to, it's not like big groups. I'm hoping they'll let us back into our little clinic sometime. But who knows? But Faye, it'd be lovely to see you. And thanks for emailing. I'm sure we'll email you some info. But if we don't, and we don't get in touch with you, please call me out. Having said about Dawn, I'm very happy to be called out live on TV because me and Dawn, we go way back. Olivia, I had mine done in India. I'm quite phobic about eyes, which probably made it worse. Okay. Yeah, eyes is a bit funny, isn't it? He's amazing, Beth. I've had no problems whatsoever in 3 years. If you want them redone, that's it. See, now they're flooding in now, the positive ones. That's it. Bit of positivity, Gemma. Come on. Gemma, Lilburn, you changed your name, haven't you? Because I don't recognise Lilburn, but you changed your name. You're under a pseudonym, but I don't blame you. Keep you know, pseudonym for Facebook. Yay! So what's going on? Natalie, what's that? Pirates? What's going on? Huh? You've been on the emojis, Natalie? Come on, step away from the emojis, girl. Defo virtual. We'll do a virtual one, girl. Let's get it on. Book it. Yeah. On a serious note, the talk about stitches was very good and helpful. That's what we like. Thank you. something helpful came out of this. Excellent. I did always wonder if you ever had any work done. Did you? Do you think this visage was? No. Yeah. Well, there you go. I love mine. Best. Look at this. These are all my accounts. Granted, I've got someone in the back office typing them all out. No, they're not. They're real people. Come on. You can see. Look at that beautiful little real person there. I don't think it is that person. I think it's her mum that's talking about. Just full disclosure for the person in there. Anyway, thanks, Michelle. Lovely to hear from you, Michelle. I don't think I've seen you in a while, Michelle. Actually, thinking about it. The exes came out again. Oh dear. Oh dear. Right, here we go. Dawn's back. I think you were poorly, Jonathan. Was it my back, Dawn? It was my back. Was it February last year? My back was bad, wasn't it? I haven't had many cancel many clinics. Was it my back? Anyway, sorry about that, Dawn. And I'll be very happy. It's a problem, isn't it, when you get one cancelled, getting it back in again. But we should have chased that, really. But when we get back up and running, you've got to get back in the system just to, because we're probably on yearly ones now with you, Dawn. But that'll be good to see how you're getting on. Dawn number 2. So this is Dawn 2. What would you do if a patient had a hernia patch where the incision line is from C-section? Would you still do tummy tuck? And also, what would you say it was if lumps kept coming out from the central muscle line where the repair was supposed to be? Would this indicate bad repair, and how could you fix, please? Right, well, the first bit, so you've got a hernia patch, so you've got a mesh, a prosthetic mesh, so a mesh foreign body in your abdomen where the C-section was, which is a thing which is not that unusual. So what would you do if a patient had a hernia patch where the incision? Would you still do a tummy tuck? Yes, I would still do a tummy tuck. It does make it more difficult, Dawn, particularly in terms of the repairing of the muscles, because you're going to have a mesh there, and the point of a mesh is to strengthen the abdominal wall, usually because someone's had a hernia. I'm going to assume it's an incisional hernia, perhaps from the C-section or whatever. A hernia is a weakness in the abdominal wall, and if you can't repair it directly, it's like having a jumper with a hole in it. Obviously, if you can repair it directly, fine. But if the hole's too big, you have to put a patch in. So you put a prosthetic mesh in, which is the patch, and then you stitch that mesh in, and then you get scar tissue growing into that patch to make a strong repair, so the hernia doesn't bulge out again. Now, when we're repairing the muscles, if there's a block of scar tissue, if there's a block of mesh there, it's quite hard to repair the muscles and bring them together with this unforgiving lump of scar/mesh. So it does. So the tummy tuck bit would be fine. It's just the muscle repair which would be difficult, and we might be limited as to the muscle repair that we could do. So it depends on how bad your muscles are in terms of the divarification of your muscles, which means your rectus abdominal muscles, your six-pack muscles, instead of being right next to each other, down here, they run as 2 lines down here. The muscles go like that. They've got lines that go like that, but the muscles go like that. And when you have pregnancy or put on weight, they get splayed apart. And as part of a tummy tuck, we bring them together. So we would be limited we might be limited as to how much we could bring them together. So that's what I would say to you if you're just having a tummy tuck and you had a mesh there. I would say it's fine to do it, but there's a risk that the divarification repair would be a little difficult, and we might not be able to get as good a repair, because when you go into virgin tissues which haven't got any scar there, everything moves a lot easier. The other risk would be infection, because if prosthetic material, just like a breast implant or a hip replacement or a cataract or a heart valve or whatever it is, if you get an infection with a prosthetic material there, and a mesh is a prosthetic material, then the infection doesn't settle until you remove the prosthetic material. So if you're going back in and doing surgery around that mesh, there is a risk of introducing infection and causing pretty big problems, to be honest. When you get a mesh infected, it's pretty horrible. Which brings me on to my your second point. What would you say if lumps kept coming out from the central muscle line where the repair was supposed to be? Would this indicate? Now, I don't know what you mean by lumps. Now, if you mean like recurrent hernia, if there's a bulge next to, so they've darned the hole in your jumper, but you're getting a hole, you're getting another hole at the edge of the darn, that might be maybe, I mean, bad repair, or maybe the tissues are, friable. It can be difficult if the tissues are friable. If you had a lot of problems with hernias and infections, if the tissues aren't strong, we can put an unforgiving mesh in, but if the tissues aren't strong that we're stitching the mesh to, it can fray, as you can imagine, just like a jumper. If the, I'm going to push on with the jumper analogy. I think it's working. It's working for me anyway. Then you could get, hernias, bulging through. The lumps, the other thing is, in the back of my mind, I'm thinking infection. If you get a chronically infected mesh, you can get lumps, you can get discharge. It's usually a bit more unpleasant, that, if you're getting discharge and lumps and what have you. But I don't think that's what you're describing. But if that happens, then you've got to think about removing the mesh, maybe, or long-term antibiotics if you can. But if it doesn't settle, then you've got to remove the mesh, which can be a bit of a nightmare, because you remove the darn, then you flip and have the hernia back, because that's why you have mesh. But you might not if there's enough scar tissue, blah blah blah. But that becomes a difficult problem. But it sounds like what you're describing, the lumps are maybe that the recurrent hernia. So then, if you have got recurrent hernias and you're having a tummy tuck, and you're looking at having these hernias repaired, that becomes a difficult problem. And you might want to involve another surgeon, a general surgeon, who sort of deals with abdominal hernias and things, might be someone who you'd want to involve with the tummy tuck. If you're, so straightforward, if you just got a mesh there from years ago, is it a problem to have a tummy tuck? Well, no, given the rider before. If you're getting lumps at the side, so if you've got recurrent hernias and you're having a tummy tuck, you might want to get a general surgeon involved, or the plastic surgeon might want to get a general surgeon to help repair the hernia, the recurrent hernia, at the time of the tummy tuck, which could be done, but it would increase the complexity of the surgery. Is that helpful, Dawn? I hope so. 3 wives with his name. Dear. Open a can of worms with that, Gemma. Anyway, Lilburn's good. Lilburn's good. Very young looking, JJ. Thank you. Thank you. Gemma, Michelle Whitaker is my friend. Oh, Beth Brannon here, looking amazing too. Let's all get together. We should have a drink, shouldn't we? That's what they're doing. Virtual night out. Actually, I shouldn't be doing that with. No, you should. Actually, leave me out of it. I shouldn't. Yeah, GMC and all that. Let's move on. Incisional. It was. I've had 5 natural births and 4 C-sections. Yeah. So an incisional hernia. So it's a difficult problem there, Dawn. You've got a difficult problem, my friend, and I think it's, I don't know. It's doable, no question about it. It's doable, but it might be a bit more difficult. Well, it would be more difficult than a normal tummy tuck. Michelle, yes, not been in for a while, but all good. Are we back when things calm down? Yeah, Michelle, please do. Be lovely to see you. It has been a while, and hope all's well. Well, it is all well, but as well as can be expected under the circs. Yes, bulges come out here and there. So how else could it be repaired? They're like hernias. Well, Dawn, I think it's going to have to be a bigger mesh. If you think about it, I think the jumper analogy is working. Your jumper, you got a hole in it. You put a patch. It's ripping through on the sides of the patch. What can you do? Put another patch. A bigger patch. You can, and there's different ways you can do it. You can do what's called onlay patch. You can put a patch on top, or you can go inside and put a patch inlay. You can do sandwiches. There's all sorts of things you can do with the way you put the patch in, what you use for the patch. So there's different types of mesh. There's biological mesh and there's prosthetic meshes. So there's all different types of meshes. It's a world of its own, to be honest with you, Dawn, which is why you might want to get someone who does hernias, which is basically a general surgeon, who are the surgeons who deal with hernias, and someone that involved, because it is a difficult problem. If you've got a recurrent hernia, if you've had a hernia and you've had it repaired and you've got recurrence of it, it's a difficult problem. As you can imagine, trying to repair a weakness of the abdominal wall, and you're putting stitches through, and the tissues are weak and friable. You're putting stitches through the jumper, and the fabric of the jumper is weak. It's tough. It's tough, and you might have to just go bigger with mesh, or put them in different ways. But it's a difficult thing, Dawn, and it's a world of its own. I've had 2 tummy tucks, and he's made the biggest mess ever. Oh God. Oh dear. Right. You know what, Dawn? I know it's not. Well, I don't know if it's helpful or not, but I sometimes see people who are desperate, and they said, "I've had 2, or I've had all this, and I've had that, and I've that, and the breast's not right, and all this." And all that. Every time we do surgery, we're giving scar tissue. Revision surgery is hard. It is hard. Doesn't matter who's doing it. It is the law of diminishing returns. It really is. And sometimes you think, oh, he'll be brilliant, that guy. I'll get that guy to do it. And like, no one's really sort of superhuman. No one's. We're all cutting and stitching basically, and it doesn't matter who you are. When you've had multiple operations, the surgery is difficult. Even if best surgeon in the world, it is difficult. And sometimes you got to think to yourself, how bad is this problem? Because best will in the world, we always want to fix it. Just like you've had 2 operations. The second operation, I'm sure the guy wanted to fix it from the first one. But now it's obviously not, and it's worse. He wasn't trying to make it worse, but it is worse. There's always a risk. I've got to be honest with you, no matter who does it, there's always a risk you make things worse. We don't go into surgery thinking we're going to make things worse, but there's always a risk of that. So sometimes you got to think, especially for a difficult problem like yours, just from what you've said here, it's a difficult problem. Sometimes there's something said for like, quit while you're where you are. Just saying. I don't know how bad. If it's a terrible problem, then there might be things, but it's a tricky one. Thank you, Dawn. Thank you for getting involved. God, I didn't have any questions, but look at that. I think you're lovely. I appreciate your opinion. Thank you, Dawn. Very kind of you. And thank you again. Just get the comments in, Dawn. Come on, you're getting your numbers in. And another one in the UK. Come on, let's have another comment, Dawn. Come on. So yeah, I had 2 questions tonight, but I have strung that. I think you'll agree. Thank you. I was a bit, to be honest with you, this afternoon, I was a bit like, oh my God. I only had 1 this afternoon. I only got the second one last minute. So thank you for that. But it's all come good. It's all come good in the end. And I've had loads of people putting good things on, which is normal for those new to this. It's totally normal. So don't make out as if it's not. So yeah. So that's me. Thank you, Julia. Stay safe. Pick up yourself. Loving the NHS badge. Thank you, Julia. And yeah, well, you know what? Let's just carrying on and doing what we can, doing our bit. And I will be here next week, next Tuesday. I'll try and make sure the notifications, whatever that is, Olivia, I don't know what the notification is, but the notification gets put on or something. Is that something I do? I don't know. But anyway, I'll try and do it next week. Post your questions, for goodness sake. I mean, thank you all for putting in questions live, to be fair, because that is reinvigorated my faith in humankind. Because I'll be honest, I was a little bit like, oh, crikey, what you can imagine, can't you? I mean, you can imagine. Imagine if you had to do a Facebook Live Q&A. Esteemed plastic surgeon, you come on and you got 1 question. Can you imagine that? Well, that was me an hour ago. But honestly, it has come good, and that is thanks to you. Thank you very much. Chats are kicking off. What's going on in the chats? Julia, stay safe. Mine came to me on the spot. Good, Olivia. That's what we like. I'll send you questions. Come on. Yeah. You're going to sing us. Yeah. Speaking of which, Jim, I'm glad you said that, because I want to promote my TikTok. I've entered the world of TikTok because I'm a liberal, forward-thinking guy, and so please join me on TikTok or whatever it's called. Subscribe to me. I don't know what it's called on TikTok. Plus, let us not YouTube. A while ago, this is how busy I've been. A while ago, I was going to put, like a few days ago, I was going to put a post saying, please help me get to 500 subscribers on YouTube. What's happened? I blinked, and I don't know what I am now. I'm probably 520. right? So please subscribe to me on YouTube and help me get to 530 or 550 or anyway, whatever the next landmark is. So let's not forget, I am, you know, you may think it just looks like a normal guy sitting here, but you're looking at a social media influencer here. This guy, I've got 2 followers on TikTok. I've got 500 subscribers on YouTube. I'm an influencer. I don't think anyone could argue with that. So yeah, please go and look at all those things. Is this a new emoji, the wet rainbow? Is that a new emoji? I'm loving it. Loving it. See you soon, Dawn. Get yourself to the clinic when we're back and running. Stay safe, Olivia. See you next Tuesday. Oh, look, Natalie's put a couple of rainbows in. Olivia's had to go the extra mile, hasn't she? That's put 8 in. Yes. Yes. Gemma, what's your name on TikTok? The Stoiano Clinic. I have reason to believe it's the Stoiano Clinic, Gemma. I put it the same as my Instagram name, which I believe is the Stoiano Clinic. I've not got TikTok. I'll have a look. Well, I wouldn't do it just for that, Olivia. You won't be missing out on anything. It is not. It is not. Dawn's in. Dawn's in with a question. That's what we want. Come on, Dawn. Dawn, you are rocking it with the comments/questions. Would a Fleur de Lis fix this, and how would living with such a massive amount of mesh all the way down front and where incisional hernia is when my stomach muscles are like jelly? No, Dawn. So there's 2 things. There's the skin and there's the abdominal wall. The Fleur de Lis is good if you've got a lot of skin, particularly if you've got side-to-side excess as well as up and down excess. So a Fleur de Lis would contour the skin in a side-to-side fashion as well as an up and down fashion. So if you had a lot of skin problems, that's where the Fleur de Lis comes in. Your problems are not skin. Your problems are abdominal wall. And when you do any sort of tummy tuck, you get good access to the abdominal wall. Well, I say any sort, not so much a mini, but certainly a full tummy tuck. The problem with you, Dawn, is it's going to be difficult because you say you've had 2 tummy tucks. You can't have that many tummy tucks because you can't get the skin out. So your belly button is fixed. So actually, it's a bit more difficult to do surgery on you because you'd have to think, what am I going to do with the belly button? Because you can't do another. Well, I'm assuming you can't do another tummy tuck because you probably won't have enough skin laxity if you've already had 2 tummy tucks. They've taken all the skin laxity away. So then you've got to think, how am I going to access the abdominal wall? So this is, you know, are you going to go through the same tummy tuck incision? Because if you go through your tummy tuck incision and then you extend up, your belly button's in the way, so you can't access the whole abdominal wall. Do you then transect the base of the belly button, which is called floating the belly button? Makes it difficult if you ever did have a tummy tuck in the future, because then that belly button would die if you transect the base. But that's one thing you could do. Or the other thing you could do, if it is an abdominal wall problem rather than a skin problem, is you could just do an up-down incision, a straight up-down incision. So the scarring would look the same as what a Fleur de Lis tummy tuck would look like, but you don't necessarily need to have your abdominoplasty scar opened again, because it sounds like it may not be a skin problem. If you haven't got an abdominoplasty problem anymore, if you had an abdominoplasty and the skin's all gone, if it's just an abdominal wall problem, the best way to access the abdominal wall, and certainly this is, so to be honest with you, Dawn, you might not even need a plastic surgeon. You might just need a general surgeon, a hernia surgeon, and they do an up-down incision, like a laparotomy incision. As I say, the same incision you get with a Fleur de Lis. They wouldn't have to do the T. They just leave your old tummy tuck scar alone, just do a straight incision down the middle of your abdomen, then access your abdominal wall and fix your hernia that way. So I don't think you need a Fleur de Lis tummy tuck, but you might need that straight up and down incision. And actually thinking about it, you might not even need a plastic surgeon, Dawn. I don't know if the mess is all abdominal wall mess rather than skin mess, if that makes sense. So it might just be a general surgeon you need, a tummy tuck surgeon. But I would probably a hernia surgeon. I always say this to everybody: try and find a surgeon. Go through your plastic surgeon first, who might be able to help you out with a general surgeon that they perhaps work with or they know who deals with hernias. Name on TikTok, please. Is the Stoiano Clinic. Can't find you on there under Stoiano. What are you talking about, Gemma? Come on. Of course. What? TikTok. At the Staiano Clinic it is. I don't. Oh, inbox. Oh, Dawn. Dawn's found me. Dawn's following me. I'm not sure if I'm supposed to follow you back. Dawn, how did you find me? It's the Staiano Clinic. Oh God, I'm doing it. I want to do one. It's at the Staiano Clinic. Thinking about it, was that not a good name? Should I just call it Staiano or something? On how do you spell TikTok? Tick. Yeah, is it tick? Is it K? Tick. Tick. Oh, God. Yep. Right. Sorry. So oh, my cat's on. So there you go, Gemma. At the Staiano Clinic, get some exciting content on there. I think you'll be pretty impressed by the TikTok. But on a serious note, how do you know skin to take, tummy tuck? Are all people's skin elasticity different? Yes, Tracy. Good question. Yes, they are. You can get an idea. Now, the first thing you do when you're assessing someone for a tummy tuck is, can you do a tummy tuck? Because some people you cannot do a full tummy tuck. You're not going to get that skin down, so they'll be more likely to have a mini tummy tuck. So what you do, I've got a video on this, Tracy, if you're now. But what you do is, when you have the markings, we mark the lower incision and the upper. I usually mark the upper incision. It's actually an M shape rather than that. But anyway, I'll draw the upper incision, but I don't cut the upper incision. I just do that just as a guide when I draw it on the ward. What you do when you do the surgery is you make the lower incision, you cut the lower incision, then you undermine up here. As I said, you undermine up to the rib cage. You keep all the skin attached, and then you pull it down. And usually, in order to get the undermining up to here, it's quite hard with all the skin in the way. You make a cut in the lower skin here. So the skin from the belly button down, you cut it in half. So there's two bits. So there's two bits of skin, and you pull it down, and you tailor tack it. You assess how you break the table. So you in surgery we break the table, so you set up like that, and then we assess how much skin we can pull down, and then mark it with a pen how much we can pull down and get closed safely. So we don't tend to, I mean, I have worked with some people who have made that top incision. I don't make the top incision at the time. I pull it down, break the table, pull it down, and then assess where I can make it safely and still get it closed. And then I make the cut of the upper skin flap. So I don't take any skin away until I'm sure I can get the skin closed safely. And sometimes, because you made a hole around the belly button and then a straight line down, sometimes you can't get all the way to above the belly button. So in some people, paradoxically, if you haven't got a huge amount of spare skin, it's more difficult, and you might have to make a little short T, and that T is where the belly button was. Make a little T-shaped scar. It's not a Fleur de Lis, it's just a little T-shaped extension. If you can't get all the skin down, it's a lot easier if I showed you. If you were there in real life looking at a tummy tuck to explain. I don't know if I've explained that very well, but basically everyone is different, and whilst you might draw the upper line, you tend not to cut the upper line. You just undermine all the skin, break the table, pull the skin down, and then you see how much you can cut away. And so someone with more skin laxity, you might be able to cut more skin away than someone with less skin elasticity. So yes, everybody's skin elasticity is different, and you assess it on the table, and you obviously take as much as you can away safely without getting with healing problems. Dawn, my belly button has been put back in wrong place. Yeah, Dawn, that's a risk of a tummy tuck. Hard to move as well. You're sort of limited how far you can move it. Yeah. Oh dear, Dawn, you're in the wars, aren't you? Yeah. General surgeon has looked. He was mortified. Oh God. At the Staiano Clinic. That's mine. That's my post. Got you. Gemma's got me. Yeah. I'm sure you'll be impressed. On TikTok. That's my post. Gemma, I want to see you do Carol Baskin one. Oh yeah, we watched that with Tiger. What is it? Tiger. Whatever it was. Anyway. Joe Exotic. Yeah, thank you. Julia, yeah, Bohemian Rhapsody, thank you. Yeah, thank you. Look, I'm getting embarrassed now. Right, okay. That's my other life. That's my celebrity lifestyle. Anyway, on a serious note, God, this has been a good one, hasn't it? Who'd have thought it? Who would have thought it? Not me, that's for sure. I would thought I was going to have an early bath today. I thought I was going to embarrass myself, but well, anyway, it's arguable, isn't it? So, thank you all for joining me. And oh my God, are my TikTok numbers soaring as we speak? I had 2. I bet I've got. Oh, my daughter will be impressed. Come on, guys, let's go viral. Oh, how do I see? How do I see? I don't know how I see it. Oh, sorry, that's me. 6 followers. Come on, 5 likes. That's what I'm talking about. I think it's lovely you're on TikTok. Thank you. Thank you. Look at that. 6 followers. Come on. I need to find some courage. Oh, I don't know about that, Dawn. Don't worry about it. No one really sees it. Well, 6 people have seen it, so you know. Oh, Olivia's off. Good night, Olivia. Sleep well. Videos, yeah. I tell you what, it's amazing what you can do. My daughter's done some amazing stuff. You fit it to the Bohemian Rhapsody. She was upset that I didn't carry it on. You're supposed to carry it on, apparently. You're supposed to press the button and then you can do another one. I didn't know. Anyway, I'm learning. So yeah, well, actually, Gemma, she won't it won't take her long to go through my videos. There's only 2 of them, but anyway, she can watch both of them. And yeah, I'll be doing something more exotic as time goes on. So thank you. I'm doing online appointments, Julia. Online appointments, yeah, doing online. Keeping it online, keeping it real. So virtual, booking virtual ones. So yeah, and still very much working. Yeah, as I say, very much working, very busy, to be honest with you. But yeah. So everybody, thank you all for participating. Very, oh, Olivia's still here. Very grateful to all your comments and interaction. Thank you for that. And what was that? Where if anyone comes, wasn't someone coming down? Get off my lane. Yeah, stay away. I am going to go and yeah, no, I feel happy about that. That's good. Thank you all, and thank you for following me on TikTok. Or 6 of you, or 4 of you. I already had 2. And I will see you same time. Good night. God bless. And same time next week. Thank you, Dawn. Good luck to you, and feel free, get your questions in, and I'll do it all again next Tuesday, 7 o'clock. Go and put your feet up and watch a bit of what's it called? Tiger. What's it called? That exotic Tiger, whatever it's Joe Exotic thing. Tiger. Big Cat Sanctuary, wasn't it? Anyway, it's called with Carol Baskin. It's great. All right then. There's my Netflix recommendation for the night. See you next week. Hasta la vista.